Hello, everyone, and welcome to today's webinar, COVID-19 Stop the Spread, Prevention Training for Employees. My name is Dominique Damian, and I'll be your speaker. I'm a safety director here at Washington Farm Bureau, and we're excited to be hosting this session for you today. We'd love to hear from you if you have any questions after today's presentation. At the end of the presentation, I will provide contact information for myself and other staff members with Washington Farm Bureau. We'd like to encourage you to share today's webinar information with other employees and others in your social networks. But first, I'd like to kick things off by taking this time to thank all employees in agriculture for continuing to provide safe and healthy food for the American people. It is you working the front lines, processing, packing, growing, trucking, and other tasks that we depend on to feed our families. We are so grateful for the work that you do. You are the real heroes when it comes to keeping this food chain in place. Washington's farms and farm workers are vital when it comes to beating COVID-19. So thank you all so much for everything you do. These are the objectives we plan on covering today. What is COVID-19? How does it spread? Prevention measures that include staying home when you're sick or when you've been around people who have been sick. Physical distancing, disinfecting, and using personal protective equipment, or PPE, which we need to add, may also present new hazards. So what is COVID-19? COVID-19 is a disease caused by a new coronavirus named SARS-CoV-2. It stands for Coronavirus Disease 2019, and it was named this because the virus was identified in December of 2019 after several cases of an unusual pneumonia from an unknown cause in Wuhan, China, were reported to the World Health Organization. It has spread across the world, killing thousands and hospitalizing even more. Reported symptoms have ranged from very mild to very severe illness and even death. The most common symptoms are fever, cough, and shortness of breath. Serious illness from COVID-19 is more likely in people who are 65 or older or have an underlying medical condition such as chronic lung disease, asthma, serious heart conditions, diabetes, obesity, kidney disease, liver disease, or a compromised immune system. This does not mean younger or healthier individuals cannot contract COVID-19, only that more serious outcomes typically present in these individuals. Some people never show symptoms. Others may show symptoms up to 14 days after they are exposed to the virus. According to the Center for Disease Control, COVID-19 seems to spread easily and sustainably in the community. It is thought to be most likely caught by persons within 6 feet of each other. When an infected person coughs, sneezes, or even talks, respiratory droplets can land in or on the nose, eyes, or mouth of any bystander. The agreed upon safe distance to avoid an infected cough or sneeze is 6 feet, which is about the furthest distance any cough or sneeze droplet can travel. It may be possible to spread the virus by touching surfaces that have these droplets on them and then touching your eyes, nose, or mouth, but this is not thought to be the primary method. Since January 2020, COVID-19 has become a worldwide danger because it spreads so easily and infected people often don't know they may have it until they start showing symptoms. Remember, these symptoms may never come or may take up to 14 days to present them. When infected people do not have symptoms, they may not take the precautions and can expose people who in turn continue to expose more people. Your cooperation is necessary to help prevent the spread of COVID-19, not only in your workplace, but in your family and your community too. No one will be able to assess your current condition or trace your steps as well as you can. Assess yourself. Do you have a fever, a cough, breathing problems, body aches, or loss of smell? Your employer may ask you if you have any of the COVID-19 symptoms, and it is necessary for you to be honest with them. If you are not asked about your current health, but you begin noticing symptoms, report it to your healthcare professional and your employer immediately. If you have not had symptoms, but have been tested and test positive, report it to your employer. If you have been near anyone who has had symptoms or has tested positive, report that to your employer as well. There are financial benefits created specifically for people affected by COVID-19. Please ask your employer about these benefits if you are concerned about missing work due to COVID-19. We are working hard to keep them up to date with the most current information regarding these benefits. Additionally, under the governor's proclamation, you must limit your activities outside of work as well. You should not make unnecessary trips to the store or other places, and you should not be involved in large group gatherings, and you should not be within 6 feet of anyone outside of your home. And keep 6 feet of distance from everyone else at work at all times unless your employer has implemented some other method of control. Your employer may have some new rules and physical changes to your workspaces to allow physical distancing. Do your part to follow the new rules and adjustments. So no group photos or flash mobs, and maintain at least 6 feet of distance from others at all times. That includes meetings, lunch periods, during breaks, and in vehicles. If it is necessary to briefly pass by someone within less than 6 feet, do it as quickly as possible and with all other possible protections. If your work does not allow you to distance yourself, ensure you follow the guidelines in the following slides. First of all, always cover your cough or sneeze with your elbow or a tissue. Then throw the tissue in the garbage and wash your hands. We will now explain the correct way to wash your hands. Yes, there is a correct way. Use running water and soap or a hand sanitizer with at least 60% alcohol. That's rubbing alcohol, not drinking alcohol. Wash your hands for at least 20 seconds. 20 seconds is about the time it takes to sing the happy birthday song twice. All right, now, first, wet your hands with water and a supply of soap, or just apply hand sanitizer. Second, rub your hands palm to palm. Third, rub palm over back of the other hand with the interlaced fingers and vice versa. Fourth, rub your hands palm to palm with fingers interlaced. Fifth, rub back of fingers to opposing palms with your fingers interlaced. Sixth, loosely clasp one thumb and rub rotationally and then switch. Seventh, rub rotationally with clasped fingers on one palm and then switch. Then eighth, rinse your hands under running water, or if you're using hand sanitizer, just let your hands dry. Otherwise, dry your hands thoroughly with a paper towel. Air dryers can spread the droplets around. Then use the towel to turn off the tap and open the door before disposing of it in the trash can. Now the hard part. Don't touch your face. Really try to limit how much you touch your face even after you washed your hands. Remember, the virus is spread by coming in contact with your eyes, nose, and mouth. Don't help it. You are probably disinfecting more frequently than you were at the beginning of the year. Keep doing it. If you can, however, limit the shared tools and equipment you use. If you can't limit sharing of equipment, follow your employer's disinfecting protocols for all of those items. Here's a list of things that we typically see shared at work sites. Personal protective equipment, telephones, pens, pencils, paper clips, scissors, or any other desktop item like computers, tools, forklifts, pallet jacks, ladders, ATVs, and tractors, and all employer-provided transportation. Also pay attention to any high-touch areas like bathrooms, break rooms, doorknobs, coffee pots, light switches and faucets, refrigerator handles. And if you're using cleaning products that you've never used before, make sure you receive additional chemical hazard communication training from your employer. Also, don't forget to change clothing as soon as you get home and wash your work clothes more often. If there's no other way to protect you from the virus, your employer may provide additional personal protective equipment. Gloves like these nitrile ones can help protect you for periods in between hand washing and disinfecting. The outside of the gloves may become contaminated though, so do not touch your face while you're wearing these either, and be careful when you take the gloves off so that your clean hands do not touch the outside of the gloves. Then don't forget to wash your hands. Face shields can act as personal sneeze guards and protect you from contaminated droplets. N95 respirators or respirators with higher ratings can protect the virus against the virus from entering your nose or mouth, but only if it completely covers your nose and mouth. If this is the first time you're wearing a respirator at work, you must receive additional respiratory protection training. Also, just to note, medical professionals recommend cloth face masks for people who must go out in public places and may be within 6 feet of other people. These masks prevent infected people from spreading it further. They do not protect the person wearing the mask, but may block some large droplets. If you are asked to or choose to wear one of these, ensure you either dispose of it properly or clean it and sanitize it, then wash your hands again. There is so much misinformation out there right now that the World Health Organization has posted some myth busters. Here are just some of them. Temperatures higher than 77 degrees Fahrenheit do not prevent COVID-19. COVID-19 can be transmitted in areas with hot and humid climates, like we've seen in other parts of the world. Cold weather and snow cannot kill the new coronavirus. Drinking alcohol, while it may relieve some stress right now, does not protect you from COVID-19. Mosquitoes do not transmit the new coronavirus. Hot baths do not prevent COVID-19. UV is not a method of sterilization against coronavirus. Taking your temperature, while it may show you have a fever, it cannot, however, detect if you are infected but have not yet developed that symptom. It does not identify why you have the fever. There is not a vaccine to protect against the virus yet. However, vaccination against other respiratory illnesses will protect you and your communities from other disease. There is no evidence that eating garlic or rinsing your nose with saline will protect against COVID-19. And yes, young people are susceptible to COVID-19 too. Your cooperation is needed after work as well. Many of you have family or other people living with you. Help take care of them too. When you get home from work, think about changing out of your work clothes and putting your clothes into the wash. Leave your work shoes, boots, coats, or other items outside of the home. Take a shower with water and soap every day after coming in contact with people outside your home. Cleaning your cell phone. Not enough people do this. Setting your clean clothes for the next day so you are already ready to go to work again. Only going to the stores if you absolutely need to, and practice social distancing if you do. Not having people visit you and not going to social gatherings like birthday parties or other celebrations. So just to recap here, there is a new coronavirus out there that is causing COVID-19. The virus spreads easily from droplets of infected people entering the eyes, nose, mouth, or other mucous membranes of bystanders. 6 feet is considered the closest you may stand for general protection from such droplets. Prevention measures include staying home if you are sick or if you have been near anyone who is sick, staying at least 6 feet away from all other people outside of your home whenever possible, washing your hands frequently for at least 20 seconds and avoiding touching your face, limiting your shared work items as much as possible and disinfecting those work items that are shared, properly wearing your personal protective equipment that your employer provides you. Don't forget that the last two may require some additional training here. And then also remember that there's a lot of confusing information out there. Make sure you speak with your employer to try to get the most up-to-date information as we keep providing it to them. If you have any questions or concerns, please discuss them with your employer first. But if you need additional help, feel free to contact us. Again, my name is Dominique. I work out of the Lacey office over here on the west side. We have Corwin. He works out of Wenatchee. Jeff works out of Kennewick, and Luis works out of Zilla. And of course, you can visit our website, WSFB.com, for some worker resources, including some stay-at-home information for those parents that are struggling with some school-age children right now, just like I am. Otherwise, thank you for listening to this presentation and for being safe. Good health to you all.